All right, everyone. Welcome once again to another episode of your Wednesday night webinar. I'm Dr. Patrick McGrath, the Chief Clinical Officer for OCD. Happy to be here with you once again on another Wednesday as we talk about all things OCD related. It was a good day today. We had the Psychology and Religion Conference talking about that scrupulosity stuff. So that was a good time and happy to have all of you here today. So let's get started. Anonymous says, ever since I started ERP therapy, I've been getting the thought that I'm pretending to be triggered. During the exposure, a part of me constantly feels like I'm faking it and lying to my therapist. Despite the progress I've made, this feeling leads to urges to drop therapy. How can I deal with these urges? Well, remember, OCD is thoughts, images, and urges that we have to learn how to deal with and recognize that giving into those thoughts and those images and those urges may be compulsions, right? So, or other safety behaviors. So in this case, leaving therapy or avoiding it would be potentially a safety behavior that you'd be giving into. And in doing that, you'd be robbing yourself of the ability to live the life that you want instead of the life that OCD wants. Now, you say, and you use one of my trigger phrases we're going to talk about, it constantly feels like I'm faking it. Okay. So here's my question. So what? Why does it matter that it feels like you're faking it? If the results are coming through and you're getting it, why does feeling like you're faking it actually matter whatsoever? I could say to you this, you know what? It feels like I'm faking this webinar. It just kind of feels like none of you really like me at all. And those of you who watch are just here because you hope that I'll say a swear word or something like that. I think that might be why you really like me. That's what it feels like. Now, Anonymous, as long as I start that phrase with, it feels like I'm justified in my statement because that's how it feels. So as long as that feels that way, it must be true. It must be real. Or maybe not. Maybe it doesn't have to feel that way, right? Maybe that's just simply not the case at all. Just because it feels that way doesn't make it true, doesn't make it real. Okay. So feels like does not have to equal anything else. All righty. Can OCD cause you to have OCD? Well, if you have OCD, then you have OCD, I would think. So I don't know that OCD could cause you to have OCD if you already had OCD in the first place. That's how I read it. But if you have any other things, traditional Catholic, let me know. Beth said your therapist thought it was funny that I told you to pretend that people outside were hermit crabs. I thought it was pretty funny too. Yeah. Well, I think you should still do it, Beth. I think that would get you out of the house. That would be great. OCD hits me hardest these days when you're tired. That can happen to people. Sometimes it's before they go to bed. Sometimes it's when they're waking up. But I feel like some of it may be because I'm compulsing ruminating mostly. Well, possibility too. So here's the thing. We know that getting good sleep is good for your mental and your physical health. So we highly recommend that good sleep hygiene be a part of whatever it is that you've got going on in your life, because that can only do good things for you. Okay. Smiley 355 says, I'm healing with my OCD if my thoughts still seem real, but I can quickly dismiss them. Am I healing? I'm sorry. Am I healing with my OCD if my thoughts still seem real, but I can quickly dismiss them? Sounds good to me. I mean, Smiley, if they just because they seem real, but you're able to go, whatever, and move on. That sounds ideal. Sounds like exactly where you'd want to be. So I'm really pleased about that. Good luck to you. Keep up the great work. Unrated Abby. I like it. Unrated Abby. No CD saved your life. Thank you guys. Well, Abby, that's wonderful. We're happy to hear that. You know, if anybody is looking for help for OCD related conditions, check us out at nocd.com. That's nocd.com. We work with body focused repetitive behaviors, tics, hoarding, OCD. We work with trauma. We work with, all sorts of great stuff like if you need it, body focused repetitive behaviors are so important to talk about, right? Skin picking and trichotillomania. We do a little bit of BDD work, and we're going to work on expanding that. And we also work with mood and depression. And we work in the UK and Canada, the United States and Australia, and we do take insurance. And we do one of my very favorite things, the No CD 411 session. If you're a friend or a family member of somebody who might not be quite ready for primetime therapy, but you have questions and you want some answers, well, you're welcome to sign up for a No CD 411 session with us. And we will give you time to chat with one of us to go over what's going on, what's happening, and get some tips. It's not a therapy session. It's more of kind of a information education session as well. So you can check out the No CD 411 sessions also. All right. Why do I doubt having OCD and just think my brain is broken? Well, one of the things that I think might be going on there is OCD is the doubting disorder. And if OCD could get you to doubt that you had OCD, then you wouldn't do treatment for OCD. And then if you wouldn't have treatment for OCD, OCD could just run amok like it would like to do. So why not try to create some doubt and uncertainty about having OCD so that you won't do anything to get rid of OCD? And if it can get you to just believe that your brain is broken, and we have no surgeries or mental health treatments for what we call broken brain, no one's come up with that, then you're stuck, right? And you don't ever have to even worry about getting treatment or anything like that, because there would be nothing that anybody could do to help you because, well, your brain is broken. Right? Or maybe it's a trick of OCD to try to trick you into not doing OCD treatment. That could be too. People ask me, am I religious? Probably because I was speaking at the OCD and religion talk today. I don't really discuss that very much, only because here's what happens in scrupulosity. Somebody will come in and say, well, you have to match my faith in order to be able to help me. And if you don't have the same faith I have, you can't help, which is incorrect, let me state, because and John Grayson talked today about somebody flew in from another country to see him in the US, and they were, so he's Jewish and they were Muslim, and they saw him for scrupulosity, and they left feeling very, very secure and confident in their faith. You don't have to share the faith of the person that you're working with, because when you come to me, you're coming to me for expertise in OCD and not in faith. Now, it is my job to have a general understanding of the system of faith you're in so that I can design good ERP exercises for you. I would never have you do any kind of exercises that would be purposefully, blasphemous or something of that nature. And therefore it's, I need to understand certain things. I'm not going to tell somebody who's, say, keeps kosher to eat pork. That's not going to happen, right? Those would just be, that would be ridiculous. So as long as I have a general understanding of the faith system and the community in which you're in, my job is to help you live within that community in the best way possible. And know that I would do that no matter what your faith is, or lack thereof too, because you can treat somebody who is an atheist or agnostic who could also have even religious-based scrupulosity, because they may say to you, I know there's nothing out there, but what if I'm wrong? And then they're doing compulsive prayers anyway, just in case. So there's lots of great treatment and ERP-based treatment for scrupulosity. Raisin says, when I finish one OCD theme, another one immediately starts, especially when I have something new I'm working on, and the fear and distress destroy my focus. I feel so helpless. All right. Well, here's the thing, Raisin. Are you approaching that? And people like Beth say OCD loves to change themes. That's for sure. Raisin, are you approaching the next theme that comes up with ERP? Or you're approaching that next thing that comes up as, Oh, shock and awe that a new theme has popped up. I can't believe it. How did that happen? It wasn't supposed to occur. I'm so surprised. If that's the way that you're replying to it, it's going to seem very overwhelming every time a new theme shows up. And it might even feel like you have to start from zero and relearn to do therapy and ERP all over again. Versus if a new theme pops up, you are able to take a step back and go, huh, you know what? There seems to be a new theme. Well, it's a good thing I know what to do about it because I've learned how to do exposure and response prevention therapy, the gold standard of treatment for OCD. And so no matter what, that's what I'm going to do. And that's how I'm going to approach this because that is the best treatment possible. Jig V6G says, my thoughts are becoming less frequent, but they are still there, and the fear is still there. Is the thought being there less of a sign of healing? Or less a sign of healing, sorry. I'm on meds, so sometimes I fear that it's just the meds. I would look at the thought being there less and less a sign that you're moving absolutely in the right direction. My concern is that if you're still having the thought and reacting to it as if it's dangerous, what is it that you're holding on to that's proving to you that this thought is dangerous and needs this level of reaction? I would ask you, how many times have you had that thought or that image or urge and something bad or awful or horrible and terrible has actually occurred? If the answer is none, then are you doing what a lot of people unfortunately do, is thinking, well, I got lucky that time, but the next time might be the time, right? And so therefore, I better do whatever I possibly can to make sure that every time I do have the thought, just in case it is that next time, I do something to neutralize it, right? Now, this becomes the problem where we hold on to the idea that the reason I'm okay is because of the safety behavior. Let's talk for a few minutes about safety behaviors tonight. There are 5 of them that we really want to focus on. There's avoidance, reassurance seeking, distraction, substance use, compulsions. If you want to stay afraid for the rest of your life about anything, do those 5 things. Avoid all of the things you're afraid of. Seek reassurance from everyone you know that you will be fine and everything will be okay. If you do have to face a fear, try all forms of distraction while facing it so that you pay no attention to the fact that you're facing something that you're afraid of. If that's not working, get drunk or high so that you don't have to feel the feelings that are going on. And if it is OCD specifically, do lots of compulsions, both mental and physical, because maybe they have some metaphysical relationship to the world to stop things from happening in some way, shape, or form. And if you do all those things and nothing bad happens, you will attribute the fact that everything is fine or okay to the fact that you did the compulsion. Or another option in this situation is just to let something be there and see how you handle it without having to do something to neutralize it. Now you might say, yeah, but what if, which is OCD's favorite phrase in the entire world, by the way, that yeah, but what if? Yeah, but what if something actually does happen? And my reply is, well, you will figure out how to handle it if that is the case. You will get a way to be able to manage it. But you will never learn that you can manage or handle anything if you use the safety behaviors, because you will always attribute the fact that things are going well in your life to the safety behaviors, and you will not learn that you can handle doing things that are difficult, uncomfortable, whatever, without the safety behaviors. Now, you may be listening to this and think, okay, that sounds great for everybody else listening to it, but my thing feels so real. Or, but what about in this instance? Or this one time 27 years ago, I did do something that was bad. And now, how do I know that I won't do it again? And only the compulsions, or there will be any and every excuse after I make those statements there that you will all come up with to try to tell me why your case is different, why your case is special, why your case is maybe the most difficult case of OCD ever seen in the history of OCD in the world. And I'm going to tell you, for 26 years, I've had people doing that to me, trying to tell me that. One time at the hospital, I may have said this story before, but one time at the hospital, when I was running the hospital program, 3 people in one day came up to me and said, I think I might have the worst case of OCD you've ever seen in your career. And the first time I thought, okay, whatever. The second time I thought, well, that's weird, 2 in one day. And the third time I thought someone was punking me. I was looking for the hidden cameras or something. So at the end of the day, I called those 3 people into a room together. I took them out of the typical checkout group that we used to do, and I brought them into a room by themselves with me. And I said, okay, every one of you in here today at some point has said to me that you have the worst case of OCD that I've ever heard of in my entire career. There can be only one of those. Therefore, like the Highlander, since there can be only one, I would like all of you to argue with each other until you come to a conclusion of who has the worst case of OCD I have ever seen in my career. After about 20 minutes, I stopped them from arguing with each other and said, it appears we are at an impasse. So now here's the deal. You can consider, each of you, that you have the worst case of OCD that I've ever seen in my career, if you want to. Or your other option is this. You could just do the treatment and see how it goes. I'm going to encourage all of you to take a look at what's happening in your life right now. How much time and energy and effort are you putting into safety behaviors versus how much time and energy and effort are you putting into living the life that you want to live versus the life that OCD wants you to live? Now, you might say, yeah, but this thing's out there and it could happen. And you're absolutely right. It absolutely could happen. It is a possibility. And everything else is a possibility too, right? Maybe you don't want to leave your home, but then what if there's a gas explosion and your home blows up and you blow up with it? And had you been out of your home, you would have lived, right? So you can tell me, yes, there could be this and there could be that and there could be this and there could be that. And you're right. This world does not come with any guarantee of safety whatsoever. So you have to make a choice. Do you live in a world that doesn't have guarantees of safety, or do you attempt to live in a world that has only safety? And I'm going to bet you'll tell me that that's a very, very small world and not one that you'll find to be very fulfilling either. My hope for you is you live that life that you want to live and not the life that OCD wants you to live. That's my hope for you. All right. Let's see. My current obsessions around a benign but prolonged and highly contagious virus at about 2 to 10% of people get each year. Okay. There is a possibility that we could get highly contagious viruses. There is a chance. You are welcome to all of the safety behaviors that you want to do in order to try to prevent yourself from doing that. That is your choice, right? But I'm going to go back to what I said earlier. You're also then welcoming OCD in so that it can be in control of everything. And if you don't get the virus, you will say, it's a good thing I listened to OCD. And if you do get the virus, your OCD is going to say, one day you didn't listen to me and that's why you got the virus. So it really is an OCD win situation in these areas if you choose to do what OCD wants you to do. Or if you do have something happen and you choose to allow OCD to tell you and you believe it when it says to you, see, had you done what I told you to do, everything would have been fine. I have no guarantee when I go outside about much of anything. Maybe it's really cold out there right now, and when I go get the mail later, I will slip on the driveway and crack my head open. Maybe I will accidentally lock the house and I will be locked outside in the cold and I will die frozen on the driveway. Maybe when I stick my hand in the mailbox, a spider will be there to bite me. I mean, who knows? I have no guarantee of safety. Now, maybe you'll say, but shouldn't we do all that we can to try to guarantee as much safety as possible? I think to a point there, that's a good thing. I put a seatbelt on when I drive, but if I wanted absolute driving safety, I wouldn't even drive, right? So life is about calculated risks and chances, and it really is up to you. Which one of those do you want to take? What to do if I suspect I have OCD, but no way to get diagnosed at this time? Well, NoCD is available online if you're looking for help with that. So you can always reach out to us at nocd.com. The National Institute of Mental Health may have some screeners that you can take a look at and see if you meet certain criteria. And if you suspect that you have OCD, even if it might not meet full criteria, but there's some obsessive types of thoughts, images, or urges, or some compulsive types of behaviors that you want to change, well, you can still apply the principles of ERP to that, even without it meeting potentially the full diagnostic criteria. Let's see. Matt says, long road with relationship OCD. How do I stop obsessing about a crush outside of my relationship? Well, Matt, I'm going to assume that you are trying not to think of the crush outside of your relationship. And in the attempt to not think of the crush outside of your relationship, all you're doing is thinking about the crush outside of your relationship. And then you're probably angry at yourself for thinking about the crush outside of your relationship. So you double down to try not to think about the crush outside of your relationship, which then leads you to think more about the crush outside of your relationship, and on and on and on. So, Matt, you welcome the thought of the crush outside of your relationship and you let it live there and be there. And eventually, I bet you it fades, more so at least than your attempt to make it go away. Because I just have never seen trying to make a thought go away work, just so you know. Spoon says, I feel like my OCD got worse after finding out what it is. Is that usually normal for people with OCD? Not necessarily. I mean, I find that a lot of people get some relief once they find out that it's OCD. However, maybe, Spoon, for you, it triggered this idea that, oh my gosh, things could be triggering to me. And so now I need to keep an eye on all those things. Or maybe you're actually just noticing more obsessions and more compulsions now that you know what OCD is, but you are actually doing them all along, just not paying all that much attention to them. So a couple of potentials there in the way some of that works. I would say that you're still in line to go do great ERP therapy out there, right? Go out and find yourself a great therapist. Check us out at nocd.com if you're looking for one, because we'd be able to help you with that, no problem whatsoever. I love when it starts with this, but what if my thought, right? And this is one of those again where, yeah, I heard what you said, but what if my thought's worse than all the other ones? What if my thought is, if I don't hurt my spouse, everyone in the world is going to die? Do I also need to accept that it's possible? Because it's not. Well, first of all, let's address, my hope is that you're not hurting anyone, and that we all know that if somebody is actually going to hurt someone, that's different than a fear of what if I were to hurt someone. So I'm wondering in this instance if you meant, what if I hurt my spouse versus I have to, or if I don't, right? So we'll always want to assess that for levels of safety for anyone. That safety check is different than OCD, right? Because I don't have to report OCD types of things, but I always am going to report if there's any concerns about the safety of oneself or others when we're talking about harm or something like that. Because there's a difference between what if I were to harm someone and I want to harm someone, I'm going to harm someone, versus what if I wanted to harm someone or what if I was going to harm someone. Very different types of things. So, if you don't do this, everyone in the world is going to die. Do I also need to accept that it's possible? Because it's not. All right. Well, if it's not, then what is the concern? Then why are you even concerned about it? If that's the case. Now, I did this several months ago. I said several months ago, this will be my last webinar because I'm wishing to be the only person left alive tomorrow. And I'm doing no compulsions to neutralize that whatsoever. And I'm doing that so that tomorrow, when I wake up and I'm the only person alive, I'm going to take my car to wherever all the supercars are around my area. And I'm going to just clear all the cars that are on the road off to the side. And I'm just going to race the supercars up and down the streets until I run out of gas, because I think that sounds really fun. So I wish that. I did no compulsions, and I came back the next morning when I woke up and everyone was still here. So I can think anything, and I can think that it's related to anything. Doesn't make it true, doesn't make it real, and doesn't mean that I have to do anything about it. Beth says you take avoidance naps and then OCD shows up in your dream, right? And Beth, I'll just say again, you could have a social life should you choose to have one. But that is up to you, and no one's going to make you do it. Let's see. My current obsessions are surrounding a benign but prolonged and highly contagious, somewhat common virus. This makes you fear it's very possible. Is there some common virus out there? This is same person, just another question about. We answered that one already, so I'm going to move on. Sorry, I didn't see that it was a repeat. Any opinions on TMS for OCD treatment? TMS is FDA approved now for OCD treatment. I would always be interested to see what the latest data is on it. I know that it's not 100%, but no treatment is. ERP is going to be your first line, though, always when you're wanting to go for therapy. And you can do combined treatments of ERP and TMS. People are doing that too. So you may get some good synergy on those things if you would like to. Do you think people should avoid getting work accommodations due to OCD? I do. And let me tell you why. Accommodations for OCD keep people stuck. Now, maybe there's some short-term accommodations, potentially, sort of, kind of, maybe, not sure, have to see case by case. But let's start with school first. Sometimes people will say, I need a private room at college. I could never live with a roommate. Yes, you could. And we're going to teach you how to do that, right? That will be something important to do, to learn that you can handle having a roommate. I would rather not be writing you, this person needs a single, right? Because this is something that is treatable and you can learn how to handle it. There would be very few things that I would think of that would require accommodations for a job. And I can't think of any that I would want to do for a long-term accommodation, because if we allow for that long-term accommodation, we're basically then not going to be working on that thing, right? So I would only want something that would be very short-term, and it would mean that we're explicitly working on that thing to be able to handle that thing at a job, if that was the case. Jack says, I noticed that I become very short-tempered a few days after completely cutting off mental compulsions. I don't feel exhausted, so I'm curious if this is OCD or your demeanor at its core. Well, it doesn't have to just be one or the other of those. It could be that you are now having to live with whatever those obsessions are, and people can be frustrated at times that the obsessions are still there, even though they've really been doing good ERP work and they're not even doing compulsions anymore. Some people come into the treatment with the goal of, I'm never going to have that obsession again. That is not the goal of treatment. We don't know how to do that. We don't know how to make that happen. So it's not about that I'm not going to have this obsession anymore. It's about, no matter when I have it, I'll know that I can handle it. And that's really, really what we want to see. So let's see. You saw a specialist. She stopped sessions as ERP was overwhelming for you and you are at a risk of harming yourself. Where do you go from here? You can't afford rehab. Well, there isn't just rehab. There's also intensive outpatient programs, partial hospital programs. These are day programs. IOP, or intensive outpatient, are 3 hours a day. Partial hospital programs, or PHP, are 6 hours a day. You are living at home while you're doing these programs, or if you travel to them, you're living in a hotel. So you're not paying the overnight bills at a hospital and for all the nurses and all of those types of things. So it's a much more affordable experience potentially than like a residential would be in these cases. Metal Moose says, I just dealt with a traumatic event that scared you more than anything else. You now relive the moment, and I'm ruminating illogically in ways it could happen again. What's the first step? Well, when we have people who have experienced some kind of traumatic event, first of all, we want to see what the diagnosis is. If it's in the first 30 days, we call that acute stress disorder. A lot of people will jump right into, oh, you had a trauma, now you have PTSD. No, not the case. PTSD wouldn't arrive until after day 30. So let's just put that out there. And then there's a whole bunch of criteria that you have for PTSD. So just because you experience something that's difficult doesn't mean that you have PTSD. I say all of that not because Metal Moose, I think you don't have it or something like that. I just say all of that because I want people to recognize it's not just that something difficult has happened and now I have PTSD. So let's say, Metal Moose, that you've had something very difficult occur and you are reliving that moment and you're ruminating on it and you want to know what to do. I'm wondering, Metal Moose, if you're spending a lot of time trying to get that thought out of your head, trying to make it go away. And if that is what you are doing, you are going to keep it stuck in your head and it will be just digging in deeper. It will not be going away. So I would encourage you, Metal Moose, to A, work with someone who specializes in this, and B, allow yourself to just let that thought or image or urge be there without trying to keep it away from you, right? I tell the story about being shot at in downtown Chicago when several years ago, and I don't try to make the thought go away. In fact, when I go downtown, just because of where I get off the highway, I pass the intersection where it happened pretty much every time I go downtown. Because not that I go there very often, but when I do, that just happens to be where it was at. And so I'm not avoiding it. I'll talk about it. I'll tell the story about it. And I have no reaction to it anymore, right? I'm not nervous when I talk about it. My heart rate doesn't go up when I talk about it or anything. Had I tried not to think about it, had I tried to push it out of my mind, had I tried to figure out everything about it and ruminate about it, I think that it would still be very bothersome to me. I think that I would feel a lot of physiological reactions when I was thinking about it, if that was the case. So Metal Moose, to me, the goal is going to be, I'm going to learn how to live with the memory of this thing and not let the memory of this thing be in control of me. I can live with a memory. And that's what I want you to really kind of keep in mind. You can live with a memory. Okay. That's really the goal. I can live with the memory. So my hope is that you will be able to get there and you will be able to see how well you can actually live with the memory of something, because it is possible. I've done it myself. How do I navigate the guilt I feel on days I feel better, have less frequent symptoms? My head tells me I'm a bad person and I don't deserve to feel better. Well, just because your head tells you that doesn't make it true or real, right? And so I'm wondering if you're using kind of this internal self-flagellation, right? I have to constantly suffer and beat myself up in order to assure that I don't do something bad, awful, or horrible in the future. Now, I would ask you, Sucker Punch, if you tell anyone else in your life to do the same. How many people do you go up to and say, you know, you seem kind of happy today, and I'm thinking you should probably feel pretty guilty about that because I know you've done some things in your life. So if you don't mind, I'd just like to remind you of all the shitty things you've ever done to bring you back down a little bit, because my concern is that if you stay really happy, you'll probably forget about those shitty things. And if you forget about those shitty things, you might be prone to redo them at some point. And we wouldn't want you to redo the shitty things because, well, they're shitty. So let's just, crap on your parade right now and remind you of all the dumb stuff you've ever done. You can bring yourself back down, and then that should get you in line to make sure that it never happens again. I mean, why would we do that, right? I would not suggest that to anybody whatsoever, that would be a good or helpful way to be able to manage your emotions and the way you feel about things. So how about this? Approach feeling better like it's an ERP, right? Be exposed to feeling good and allow for yourself to say, boy, I think I should feel guilty about this. And I'll accept that I think that I should feel guilty about this. And then I'll move on and still go do whatever I need to do, feeling as good as I do. That's where I'd like you to go. That's what I would like you to do. Let's see. User says, I mindlessly scan my scalp with my fingernails, probably looking for anything not leveled to pick at. It's like autopilot. How might ERP help with this? Well, what we would first do is we would want to introduce a form of treatment called habit reversal treatment, or HRT, habit reversal therapy. And one of the first things that you do in that is you can create a barrier that will bring about awareness. So what I want you to do, user, is when you're sitting down at a table, watching television on the couch, something like that, maybe going into bed, I want you to put a glove on the hand that you normally use to scan your scalp. And every time that you go to scan your scalp, it's going to feel weird because it's the glove. And it's be like, right? And if we can start to bring conscious awareness to the experience of you doing that, then it will potentially allow for you to start breaking the habit. Because I'm betting that right now, you don't even notice when you're doing it, right? It's just something that's happening and you're not even aware of the fact that it happens. Sometimes people will do this with hair pulling as well, and they may look down and there's either a pile of dead skin or scabs or hair on their lap or something like that, and they don't even realize that they've done it, and they might have been sitting there for an hour or two. So starting with that barrier, that's the first thing that I would do. But if you are looking for help with that, it is something we treat here at NoCD. So please feel free to reach out to us and we can get you set up with one of our therapists who does work on habit reversal training. Are OCD and ADHD repairable? Is it treatmentable? Treatmentable. I like that. Yes, they are. They are treatable. Absolutely. There are treatments for both, and both are kind of a behavioral based treatment. You've got some good CBT for ADHD, and you've got exposure and response prevention, ERP, for OCD, and you can definitely do treatment for both of those. Absolutely do that. Beth said, do you feel mentally exhausted after these sessions and sessions with your patients? Talking about these things, thinking about these things day after day is tiring for you. So it must be exhausting for me too. Am I mentally drained? No, I'm not. Uh, I told this story today at the conference, and I'll tell it here. Sometimes people will say to me, I'm really sorry. I just unloaded a bunch of stuff on you there. I know I'm your last patient of the day, and I'm just worried that now you're going to be thinking about everything we talked about for the rest of the night, and you might not even be able to sleep because it was so much. And I look right in the camera and I say, when I turn the Zoom off, I'm done. I won't be thinking about you. I'm going to go upstairs and I'm going to make my dinner. I'm going to probably throw something on TV, maybe call a friend or two, family member. I'll get a workout in, and then I'm going to go to bed. So, no, I will not be thinking about this session and everything that we talked about. And sometimes people look at me like, did I not say enough? And others are just kind of surprised at my honesty about it. But I look at it this way, Beth. I need a break, right? And if I don't get a break, then I'm not going to be good for everybody tomorrow. So I've had to really practice being able to walk away physically and or mentally from my work so that I allow myself the opportunity to charge the batteries a bit so that tomorrow I'll be able to come back and do it all over again. Right? Now, this can be very hard at times, right? For years, that was very difficult for me when, as many of you know, my wife passed away from cancer. That was very difficult because I would leave work and the stresses of that, or, the things that we talk about, like you say there, Beth. And then I would go upstairs and become a caretaker and take care of her. So it was imperative in those times that I made sure, even though it was shorter than I wanted, to carve out time for myself. And at first, I will tell you this, it felt very selfish because she couldn't really walk much anymore or get out or do things. And I would go out for a walk, or on the weekend, I would have somebody come over and stay with her while I played golf for a couple hours. I didn't like that at first because I did feel bad, right? I really did. But I also realized that if I was just isolating at home with her and doing this all day and that all night and not taking any time for myself, I was getting run down. I was getting tired. And I was, right? I would have to stand up in meetings sometimes, right? Just because I would have trouble focusing. And so I credit some good friends and family members who would come over and say, get out of here, go do things, just go. And we got it. We'll cover it. And those people will always be very special to me because they allowed for me to take a break, to charge the batteries a bit, and to go ahead and be my better self. Because I had a chance to get that recharge going. Rhonda says, these webinars are so helpful. Oh, thank you. It's like a support group, like Weight Watchers. Well, okay. Meaning it's not that we don't know what to do like ERP. It's more a reminder and reinforcement and support. Oh, I love it. So that's great. A cat by the name of Meow 5563 says, what do I do with pure OCD? I say, throw it out the window. That's what here's what you do. So what do we mean by pure OCD? We mean OCD that has mental compulsions, no physical compulsions. So there's the obsessions and then there's mental compulsions. And what do you do with it? You do ERP with it. That's what you do. You do ERP for the mental compulsions. So you work with a therapist. You let them know all the different mental compulsions that you're doing. You two work on discovering those things together, kind of ferreting them out, figuring out what they are. And then you attack those with great ERP. That's what you do, right? And in doing so, I think that you will find that it can be very, very helpful, just like for physical, right? A lot of therapists who are new sometimes are a little afraid of mental compulsions. They're like, I don't know what to do, right? Well, you do the same thing you would do for physical ones. You find out what the compulsion is, and you come up with some kind of opposite behavior or mental act for somebody to do that gets in the way of doing the compulsion. And your focus is on allowing people to live in doubt and discomfort instead of trying to do the compulsion so that they have a sense of relief. All right. I found that when a new theme pops up, it's because you brought a different theme below the level of the new thing. Sometimes this can happen where, maybe you deal with a theme and you think, okay, great. And then one that used to bother you, but now this one superseded it and that one seems like nothing anymore. Now that one's out of the way, that old one can come back and go, hey, remember me? I'm back again. And so you're still going to potentially want to work on that one too. I'm getting blood work done on Friday to test for an ongoing GI issue and cannot think about anything but having cancer. I'm starting to feel more and more symptoms. Well, and guess what? You will feel more and more symptoms, right? Because think about how suggestible we all are. Let's try this. Let's just do it. When I do talks, sometimes I do this. I talk about lice and how, lice live in your hair and they crawl around on your scalp and they like to dig into the roots and then kind of have little babies in there. And then those little babies scamper all over you. And how many of you want to do this right now where you're just like, it took just like 30 seconds of talking about lice and suddenly you might have felt like you needed to scratch. So Jenna, the more that you're trying to not think about cancer, which now seems impossible because you say that's just what you're focusing on, you're starting to feel more and more symptoms. Well, yeah, right, because you're scanning. And when you scan for things, you find things. My good friend Chrissy Hodges will talk about this with groinals, right? What's the groinal? The feeling in the groin area, right? And what do? You're scanning. So if all of us do a groinal scan right now, I think I feel something. Why? It's part of our body. Why wouldn't we feel something down there if we're scanning down there and it's a part of us? But we've made this ridiculous rule for ourselves that says, now when I do that, I should feel absolutely nothing. Well, who says you should feel absolutely nothing? Why should you feel absolutely nothing? And then there may be some kind of correlation, right? Well, I ate this and then I felt this, or I thought this and then I had this tingle, or whatever it might be. So Jenna, I'm not shocked whatsoever that you're starting to feel more and more symptoms, because all you're doing is scanning that area more and more to see if you're feeling something, right? It would be like, let's say that I had a little pimple or something, and so I start picking at it and everything, and then, oh my gosh, it's getting redder. I wonder why. Well, let me see what's going on. So I pick at it more and more. Oh, shoot, it's getting redder. I can't understand why. Let me pick at it more. My whole forehead's now. I don't know why. Well, let me keep picking at it to see why. And guess what it's going to do, right? The very thing that we're doing to try to help ourselves feel good becomes the very thing that gets in the way. And so, Jenna, good luck with the test. I hope everything goes well and comes out great for you. But I will tell you this, all you're going to do by hoping not to have cancer is make yourself feel more and more symptoms that you might have it. Smiley says, back in 2019, when my OCD was at its worst, I did a lot of avoidance and drank to calm the intrusive thoughts. Yep, that's for sure. I don't understand the link between physical compulsions and my anxiety toward real life events, but stopping the compulsion helps. Why? Well, here's the deal. You don't have to understand. In fact, it's written into the definition of OCD that it doesn't have to make any sense why doing this compulsion somehow neutralizes this obsession, right? I will give you an example. if I shut the car door and I get a call from my aunt that says she fell down the stairs and she needs help. So I rush over to her home and I pick her up off the ground, and she's okay, right? Nothing's broken or anything like that. She's banged up, she's bruised, but nothing's broken. I go back home and I close the car door and it doesn't feel quite right. So I open it and then I close it again. And this time it feels good and it goes dunk, makes that door close sound, right? And it's like, oh yeah, that sounded right. It felt right. Okay. Oh, and hey, look, no phone call. Huh, interesting. I wonder if the way I close the door somehow keeps my aunt from falling up or down the stairs. And then 3 months from now, it's 3 a.m. and the police show up at my house because I'm out in the driveway and I'm slamming the car door at 3 a.m. and my neighbors are just up in arms. So they call the cops on me. Officer comes over and says, sir, is there a problem? I said, well, officer, I can't seem to get the car door closed. I don't understand what's going on. Mind if I try, sir? Yeah, please, officer, please go right ahead. And the officer closes it. And officer, you're a miracle worker. My holy cow. I can't believe it. You did it. Thank you so much, officer. It won't happen again, I promise. My apologies. And please, if anybody has called, let them know I'm sorry. I'm just going to get into the car here now. I'm going to pull it into the driveway, actually, and there will be no more disruptions tonight, I promise. All right, sir. Thank you. The officer drives away. I pull it into the garage. I close the car door. Close the car door, close the car door, close the car door, close the car door. Because that officer didn't close the car door right, just so you know. It's not that the car won't close. It just won't close the right way. And the right way is the way that feels the right way. And it feels the right way when it feels the right way, which sometimes could be after 12 and sometimes might take 739, right? It is what it is. So there we go. User says, I've used binge eating as a way to cope with fear, anxiety, and uncomfortable feelings. It's terrible. I'm not sure if using food as a distraction or avoidance or compulsion or just self-soothing. There's a lot of self-soothing that can go on with binge eating. One of the things that often happens with binge eating is we eat things that are high in carbs, and high in carb things can give us a rush of serotonin. Serotonin being one of the neurotransmitters that we notice or that we know plays some kind of role in mood regulation and potentially OCD and things. Those are the medications that we take. And you can see that spike in serotonin that people get, and they will often report that it feels kind of good when that happens. And then it wears off. And it doesn't just go back to where it was, it dips. And then it has to come back until it's kind of level again. And when it's at that dip and you're feeling really low, what do you want to do? Eat more. Right. And so now you can get in this boom, 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 kind of back and forth about eating and utilizing food as a way to help regulate some of your emotions. Now, here's the good thing, user. There's great treatment out there for binge eating, and I would reach out to somebody to get help with that because, again, you can absolutely get some help with that. Court is so cutie. What if safety behaviors align closely with safe driving habits, e.g. checking mirrors for reassurance when going over speed bumps or passing crosswalks? What's an effective way to integrate ERP then? Well, let me ask you this. Do you have to check a mirror when you go over a speed bump? Do you have to check a mirror when you go through a crosswalk? Is that mandatory? Is that necessary? Or do you do that as a safety behavior? Right. So maybe if there's a speed bump on your street, right? Maybe one of the things that you could do is just take your mirrors and turn them up to face the ceiling and the sky, and then just drive over the speed hump a few times without being able to check your mirrors to see if there's a dead person laying in the road behind you. Right? Do this on a side road, not busy, something that, nothing like huge or anything like that. But that's what I'm saying, though, is like, do you have to check those things? I don't think you do. I don't think it's necessary or mandatory. But it may take some intervention to practice not doing it because you're so used to doing it. Okay. Not engaging in rumination is often the last hurdle to overcome for my recovery during episodes. Any tips for how to curb this tendency to work or at work when I'm surrounded by stimuli that feed rumination? Well, you could practice at home. One of the things that you might do is that whatever the stimuli are, you can make a loop tape of those and then just play it in the background until you get to a point that it becomes background noise. And then when you hear it at work, hopefully it's just background noise too, and it's not so triggering anymore. So I've had people do that where they've taken words, phrases, little stories, paragraphs or something, loop it, play it over and over and over and over until it's just, they're not even noticing that it's on, right? Sometimes like, what do you listen to? It's like, oh, shoot, geez, I forgot I was listening to this thing. Yeah. And by doing that, that might be a way to help you overcome being so reactive to some of those things when you do actually hear them. All right. Let's see if there's any other quick little ones here at the end before we take off. Do we see OCD flare in postpartum? I've had OCD my whole life, but it was very manageable until now. Yes, Jig, that can very much happen. There can be, well, there's two options. Could be a hormonal reaction, and it could be a stressor reaction. It's not necessarily that it's one or the other or both. It could be one. It could be the other. It could be both, right? It just kind of depends on the person, but absolutely. And here's the thing: ERP works great even in the postpartum experience as well too. So if you're experiencing some kind of a perinatal OCD or a postpartum OCD, I would encourage you to absolutely reach out and get some help because that is very, very treatable. If you are looking for help, well, hey, we've got it for you. Check us out here at nocd.com. That's nocd.com, where we work with body focused repetitive behaviors and tics and hoarding. And we work with mood conditions and trauma and depression and body dysmorphic disorder more and more. So please check us out at nocd.com if you're looking for anything. And we would love to help you. Until next time, I will be here next week, even though it is the Wednesday before Thanksgiving. I'll be here. So let's all join. And if anyone wants to send a turkey, I'll gladly take it. Thank you very much. Until then, everyone, be very, very well, and be better to yourself than your OCD is, because it's not very nice. Talk to you later.